In this third portion of the lecture, we're going to take a look at how the arterial flow leaves the heart and goes into the rest of the body. So, in taking a look at this image on the left here, again, we've already seen the blood flow as it traveled all the way through the heart and out through the lungs, coming back into the left atrium, the left ventricle, and then now going out through the aortic valve into the ascending aorta. From the ascending aorta here, we're going into the aortic arch, and off the aortic arch we have the three great vessels. The brachiocephalic trunk or brachiocephalic artery, either is correct. The left common carotid here, you can see the label, and then the left subclavian vessel here, left subclavian artery. So brachiocephalic trunk or artery, left common carotid artery, and left subclavian artery here in red. And remember that left brachiocephalic vein passes in front of those three great vessels that we were just talking about. From there, the vasculature of the aorta goes into the descending aorta and then travels down and becomes the abdominal aorta. And we've already covered that in great detail under the abdominal section of the lecture. And we will be covering the neck and the head arteries in more detail when we cover those areas of the body. But we'll take a look at these vessels here that we were just discussing, the great vessels that come off the aortic arch, in the next slide on the CT images. These CT images are seen from superior, and this is more inferior, and this is further still inferior. So we're going to start with this one. This is the most superior, and we've got the right brachiocephalic vein. Remember, so this is the vein, not the artery. And we've got the left brachiocephalic vein passing just posterior to the manubrium. So these two are going to join together to become the superior vena cava. So right brachiocephalic vein, left brachiocephalic vein. And the left brachiocephalic vein is passing anterior to the three great vessels, the brachiocephalic artery or trunk, both are correct, the left common carotid artery, and the left subclavian artery. So right brachiocephalic vein, left brachiocephalic vein coming across to form the SVC, the brachiocephalic artery, the left common carotid artery, and the left subclavian artery of the aortic arch. So when you take a look here, we've gone a little bit more inferior, and you can see the entire arch now, but you can't see any of the vessels coming off of it. The left brachiocephalic vein and the right brachiocephalic vein have joined together now to become the SVC, and you see the trachea sitting to the right of the aortic arch and posterior to the superior vena cava. And then if we move more inferiorly than this slice, then you'll see that the aortic arch has become two distinct vessels, the ascending aorta and the descending aorta. And the SVC again lies to the right of the ascending aorta. Posterior to these two vessels is the trachea. You've got the esophagus sitting here in between the trachea and the descending aorta. Very briefly, I want to cover the arteries that go into the neck and then on up into the brain. We won't cover that portion today, but just so that you know a little bit about where the arteries go after they leave the aortic arch. So the subclavian arteries take blood out to the arms, and then the internal carotid arteries travel up into the neck and brain, and they bifurcate into the internal and external carotid arteries. And the internal feeds into the brain, and the external feeds into the face. It's the same on each side. This is the right internal and external carotid artery, and the left internal and external carotid artery. And then also off of the subclavian arteries, you have the vertebral arteries here. And this is the left vertebral artery and the right vertebral artery. And this goes up to become part of the circle of Willis, which is the vascular flow into the brain and that feeds the brain. And we'll cover all of that when we cover the brain lectures. But I just wanted to give you a little overview of how that's going to look and give you a couple of images now in CT on the next slide so that you're able to see how those look on CT. The first image here on the left is actually an MRA or an MR angiogram, and they have rotated this patient slightly to the side. So this is a lateral view. So the images or the vessels coming off the arch are more difficult to distinguish. But I wanted to point out how the vertebral arteries there you can see coming off the subclavian arteries, and you can see how they're kind of tortuous as they go up and into the brain. The common carotid artery is a little bit more of a streamline artery. It just goes directly up the side of the neck, and then it bifurcates into the internal carotid artery, which feeds the brain, and the external carotid artery, which feeds the face. So you've got the patient rotated slightly to where the front of the body would be here, but it's not a direct lateral, because you can see that it still says right here. And so the patient's left would be here, but it's slightly rotated because otherwise it might be more difficult to distinguish this external carotid artery there from an anterior view as it comes off anterior and feeds the face. And then here, when you take a look at this image in CT, this is an image that's a little bit more inferior, and then you've got one that's a little bit more superior of this one. And so the inferior one, as the vessels come from the aortic arch, you've got the internal jugular vein here on each side and the common carotid artery. So this is not bifurcated yet. And then these are the vertebral arteries. So you can see how close and in next to the spine these run, and they run in the little grooves within the spine, and we'll discuss this a little bit more when we're talking about the cervical spine and the anatomy around here. But then when you go a little bit more superior from this image, you can see how now the carotid artery has bifurcated, and now you have the external carotid artery anterior and just a little bit medial of the internal carotid artery. And this external carotid artery will go off to feed the face and the jaw, and the internal carotid artery will go up to feed the brain. And once again, you've got the internal jugular vein. On this side, the common carotid artery has not bifurcated just yet. So either the patient is a little bit tilted, or their anatomy is such that their vessels do not bifurcate at exactly the same level. We're taking some fairly thin images here. So within 5 millimeters generally. Sometimes it's a little bit smaller than that, or sometimes a little bit larger. But so within 5 millimeters, you could easily miss the bifurcation on one side, but not the other. So vertebral arteries branch off the subclavians, and they turn medial to course through the foramen of C6 through C1. Again, we'll talk about that more when we're going over the neck. And then the common carotid arteries course from the arch, the right brachiocephalic superior, and they bifurcate at about the level of the hyoid bone, the lower margin of the hyoid bone. And then the internal carotid arteries course posterior again to feed the brain through the carotid canal of the temporal bone and along the carotid groove of the sphenoid bone. And then the external carotid arteries course anterior to feed the face.